Hello, I'm Dennis McKenna. Welcome again to another edition of Inside Albany Med. And today I'm so pleased to be joined by my great friend and a great employee, Amy Muller.
Hi, Dennis.
It's good to see you.
I should call you D-Mac.
That's right. We have nicknames for each other. And,
yes, we do.
well, that's because we work together. And
Many
let's go back. So
Mm-hmm.
I first started in the emergency department as an intern in 1997. You were a nurse there. We worked together for many years down there.
Mm-hmm.
I know that you were one of the nurses that I remember from the very beginning who I absolutely wanted in the room with me. In fact, we've talked many times about times when I'd be in a room with a sick patient and I'd look down the hall and I'd say, Amy, I need you in here right away. And so you were there for many, many years. Any memories from working in the emergency department about your time down there, people you worked with?
Yes. I think that the best part about being down there was you always had a sense of family down there. Mm-hmm. Everyone took care of you. You would hear a shout for I need help in here, and everybody would drop things and just come and do something for you. Some of the remarkable stuff was you never knew it was coming into the doorway.
Right.
And for me, that was the exciting part about it is you could have more routine stuff. You'd have time to be with the families. And yet when there was a bigger emergency or something more urgent, you were able to just drop it, go take care of that, and you always had the backup for everybody there.
You transitioned then to another area that's very important to the medical center and to me personally, the transfer center.
Yes.
So how long have you been there?
I've been here since 2012, so 9 years.
So for those who may not understand the role of the transfer center, any given day here at Albany Medical Center, if you are in a patient bed getting care, there's a 1 in 4 chance, probably 25% of the people started their medical journey at another hospital.
Correct.
And they were transferred here. So in a given year, 16,000 patients will come in from other hospitals. And there are skills that you had in the emergency department that are translatable to work in the transfer center, the ability to multitask.
Correct.
The ability to manage chaos and create order out of it. The ability to take situations that are complex and simplify them.
Correct. A lot of times, if you are a little unfamiliar with certain critical care things, if a physician is calling and asking for a particular type of bed or a service, but you're hearing the story, you can help them facilitate the exact correct service and the bed, and then we connect from their doctors to our doctors. And that's how we kind of make it the best place, the best bed, and the best service possible for them as well.
Do you ever listen to the news or read the newspaper about a patient who was injured somewhere up north, and then you think to yourself, oh, I know that patient because I helped get them to the medical center, and the care they're receiving is in large part because you helped facilitate that?
Right. A lot of times, some of us, you'll hear them in the background go, that's my patient. So even though we don't do bedside nursing, it's still something that we owned that part of it. We feel like we made a big difference. And then that brings to mind when we had the Dunkirk moment with helping facilitate all the patients that were going to need to come out of New York City during COVID.
The first request for transfers was March 30th of 2020. And then about a week later, there was another request. And in this particular time, it was because the oxygen that they used, all of a sudden their supply ran out. And I assume that there was a more urgent need to transfer those patients. And that's what you're referring to when you said the Dunkirk moment, because it was this mobilization of all these different ways to transport people.
Apparently, because like so many of their patients were all on some version of oxygen, the more that the hospitals were drawing from the supply inside the hospital, it actually froze the lines. So it was more that they couldn't get it. And so all of a sudden they had people that had to have some kind of oxygen, even if they weren't on ventilators. Suddenly there was this, what do? We need these people out now. So they ended up coordinating this massive flight pickup. I believe initially they had probably 8 or 9 helicopters that were coming in.
Right.
And they were flown in from Pennsylvania, certain parts of western New York State, etc. I don't know exactly where they had all come from, but there was a bunch of them, and they all had to quickly move these ventilated patients. And that for me was like a big scramble. And I loved it because it was like being in the ER again. It was like hurry up and kind of shift it around and make the appropriate calls. And again, St. Peter's helped out with that too.
Another thing I know about you love animals. And you have horses and you
Mm-hmm.
have dogs. And so if anybody walks into the transfer center on many days, they find a little furry companion sitting next to you.
Correct.
Why is that?
Well, It actually started once I left the emergency department and came up to an office setting. My niece is losing her vision to Stargard's, and you have this feeling of helplessness, kind of not being able to do anything to prevent that. And yet, when I had gone into a store and I saw this gentleman working there full time that was telling me that his dog was going to have to be retired, he was on a waiting list, all of a sudden something clicked. And I thought, how can I help somebody who clearly needs a guide dog, and hopefully not, but if my niece ever needed a guide dog, I could actually be a puppy raiser, because a friend of mine told me about it.
Right.
So I've now raised 6 dogs over the span of about 7 years, and 5 of them were for Guiding Eyes, and 1 was for Blue Path Autism for autistic children.
And when you bring them into work, what are the things that you're doing with them at work that allow them to learn how to be around people or different situations?
They learn how to be confident. Underfootings is a big thing. Slippery floors,
Right.
graded stairs, noises. With all the construction that was going on, there was great opportunities for the cranes were there and the
Right.
diggers, and they ended up just really learning how to just settle down. And you could throw food on the floor next to them, you could slam something down, and they really don't even bother them. And I really feel that Albany Med made a big difference, because 4 of them became working guides.
And I know a lot of us like to come down. I know Bob Palumbo will come
Oh,
down.
my goodness.
We pop in, we see the dogs and see where they're at. So.
Therapy for the staff here
It
as
is
well.
therapy for the staff.
And I do bring them down to the PDD, and I've walked around in some of the areas where it's okay for them to go into.
Yeah.
It's fabulous.
It's a remarkable program. You deserve tremendous credit. Changing
you.
lives of people who need to come into the medical center, changing lives of people in the community because of the work you do with them. And I think it's wonderful. And I want to thank you very much for everything you do. And hopefully you'll continue to do it with us for many more years.
Hopefully. 37 so far, so we'll see.
All right. Well, Amy, thank you so much. This is wonderful. I appreciate you very much.
You're welcome.
All right.
Thank you.
Okay, bye.